And good morning, everyone. Brad Zaruba here with Dr. Stephen Sinatra. He is a noted cardiologist, amongst other things, a speaker and author. Dr. Sinatra, good morning and welcome.
Hey, it's great to be here, Brad.
I went to go through and list all of the credentials that you hold, but I think it would take up all of our time. Safe to say, you're with Healthy Directions now, is that correct?
Yes, sir. I've been with them for almost 30 years now. It's a great company, and I'm happy I'm with them.
What does that mean then to us specifically in Missouri?
Well, basically, as a board-certified cardiologist and internist, I treated a lot of patients with non-pharmaceutical therapies, and I've been doing that ever since I got my board certifications in 1977. And I developed a lot of vitamin and mineral formulas myself. And then about 7 or 8 years after that, Healthy Directions sort of contacted me. And I was, working with them on and off. And then all of a sudden, I started to work with them exclusively. And I've been developing, vitamin and mineral formulas and products for them, again, for the last 30 years or so. So it's been a good ride for me.
I mentioned that I am sort of technically retired, meaning I'm old enough to be retired, put it that way. Do people like me I'm 68, I ride a bike every day, I feel like I'm healthy. Do we sometimes not really pay attention to some signals that our body might be giving us that we need to be aware of, just things that are going to happen to people our age?
Well, I mean, the most important thing is you live your life, but if you develop a symptom, for example, I used to hear this from patients all the time. Doc, I'm walking the dog and I get cramps in my legs now. I never used to get cramps in my legs. Or Doc, I'm walking the dog, or I'm in an argument with somebody and all of a sudden I have chest pressure. I never had it before. So the emergence of any new symptoms that are occurring in someone like yourself, 66 years old, or anybody, over the age of 50, the emergence of a new symptom that is foreign to the person, they never had it before, and it keeps reoccurring, is something that they should talk to their doctor about. Absolutely.
My doctor did just retire, one that I've had for almost 20 years. And one thing that I really enjoyed about visiting with him was he always had something new. He said, I just came from this conference where I learned something. Do you have that thirst for knowledge that a doctor of your, who's been around a while, that you still think, hey, there's more for me to learn?
Absolutely. I got to tell you, Brad, I'm going to be 75 years old in a few months. And I still lecture at conferences and I go to conferences because one thing about medicine, it's always changing. It's absolutely changing in front of us on a daily basis. What we believed a few years ago may not be true right now. That's a simple fact about the medical field. So going to conferences and keeping up to date is absolutely vitally important for any physician because things are changing rapidly. I mean, look at COVID-19, for example. I mean, things are changing right in front of our eyes. So it's really important to realize that if you read something in a journal, it could be 6 months to a year old. If you read something in a textbook, it could be 2 years old. But if you go to a conference, you're getting current leading edge information that's contemporary right now. So I encourage any physician to continue to go to conferences on a day-to-day basis. Even if they're virtual, they're still outstanding.
Let me now switch a bit to heart disease and allergies. It seems like we're always in the allergy season because we're kind of on the cusp of being in the South. So it seems like our seasons last longer. How do those two interact, allergies and heart disease?
Well, we know that the root cause of heart disease is really an inflammatory response that occurs in the body. I mean, years ago, we used to think it was cholesterol and stuff like that, but that's sort of been put to bed. So basically, the inflammatory component of heart disease is real and it's true. Now, allergies set up an inflammatory component. People don't realize it, but if you have allergies, let's say like for example, in myself, I had hay fever when I was in Connecticut, living in the Connecticut Valley as a young doctor, and I would get itchy eyes, runny nose, sometimes a cough, sputum production. But when I developed extrinsic asthma and I had difficulty breathing, that was a warning sign that the allergy was leading to an infectious situation. And I remember seeing, a lot of my colleagues. I saw, lung specialists, infectious disease specialists, and I was placed on all sorts of medications. And the thing that really made a difference in my life, Brad, I got to tell you, is I had to move out of the area. Now, leaving Connecticut in April and May and June was vitally important for me, because once you get asthmatic symptoms and an intense inflammatory response in the lung, something has to be done. And with me, leaving the allergic response or getting away from the allergens was really the best thing that gave me comfort in my life.
Many years ago, more than 20 years ago, I lived in North Carolina, and the property I was on had 50 pine trees surrounding me. I definitely had allergic times.
Pine needle, yeah, that's a common one. You're right about that one.
Well, it all went away now. So one thing that I noticed, I worked in a pharmacy for 3 years, that people always tried to find the cheap way to take care of things. So our over-the-counter allergy medications, I don't think you're going to give that a thumbs up.
Well, it gives you a short-term fix for a lot of people. It's like aspirin for a headache, for example. But I got to tell you, in an aging male, and that could be a male just over the age of 50, in an aging male, even in my practice, which was exclusive, cardiovascular disease, I had men tell me that, doc, I had difficulty urinating. In other words, a lot of these over-the-counter medications can have a negative effect, especially in a male with an enlarged prostate, which is very, very common today because of all the allergens in the environment and all the impurities and stuff like that. So it's important to realize this. So if you're a male and all of a sudden you have difficulty with urination, taking over-the-counter allergy pills, you need to talk to your doctor immediately and stop, because I'll tell you this, Brad, acute urinary retention in a male is a medical emergency, no doubt about it.
I tell you what, when we come back, we're going to talk about diet, and can diet help as it relates to allergies, and we'll do that in just a minute. And welcome back, everybody. Dr. Stephen Sinatra is with me today. He is with Healthy Directions. Pleasure to visit with him. He has 40 years of clinical practice as well, founder of the New England Heart Center. So someone who knows these things. What about diet? Does that matter when we're talking specifically about somebody dealing with allergies?
Yes, it does, Brad. A lot of people don't realize it, but if you have like food allergies, like, for example, there's a lot of people that have a gluten type allergy, and we didn't see this a few decades ago, but the wheat has changed in Canada and the United States. There's a lot of GMOs. The wheat has grown a lot larger. This has changed the architecture of it. And some people have developed an allergy to wheat. So basically, people can have a gluten allergy. Certainly, people have dairy allergies. I've seen that over and over again. And the worst thing when you're dealing with an allergic response is sugar in the body. Because sugar, if you overzealously use sugar and you're using dairy at the same time and maybe even gluten, this is the unholy trinity, I got to tell you. So if you're living in an area that has a lot of pollen, for example, or pine needles, like you mentioned before, and all of a sudden, you're sneezing, you have itchy eyes, now you're coughing, think about the component of food allergies as well, because an undisclosed food allergy superimposed on a pollen allergy puts you in double handcuffs. And sometimes these people can get deathly ill, especially with asthmatic symptoms. So if you do live in an area where you're allergic to the pollen, I would go dairy-free, gluten-free, and as much sugar-free as possible, because that in itself can give you a better quality of living, especially if you're allergic.
Let me ask you about something that I don't think I would have ever thought about as kind of a help with allergies, and I doubt that most of our audience does either, and that is acupuncture. How does that?
Oh, yeah. Listen, when you have an allergic response, you can definitely get a hyperactive, what we call autonomic nervous system. Basically, a lot of these people are vigilant. It's like waiting for the other shoe to drop. You're sneezing, you have itchy eyes, you're miserable, your adrenaline is going higher, your cortisol is going higher. So basically, sometimes acupuncture can interrupt this sympathetic overdrive we have with the central nervous system and calm down this overzealous active sympathetic nervous system. Now, some people may not want to get needles, put in acupuncture points, and I understand that. But I'll tell you, earthing and grounding may do the same thing, and it's free. I mean, you can walk barefoot on Mother Earth and take in, what we call a Schumann resonance, take in Mother Earth energy, and the Mother Earth energy in itself can help to attenuate an overactive sympathetic nervous system. So whether it comes to, if you are allergic and you want to, bring natural remedies to the table, I think Mother Earth and putting your bare feet on the Earth's surface is just absolutely incredible, because you'll be taking in so many antioxidants through what we call, the K1 point of the foot, which is really an acupuncture point of the foot where you're taking in all this Mother Earth energy. So grounding and acupuncture sort of are like kissing cousins. But again, one, you don't get needles, and the other, you put your barefooted on the grass or concrete or the seashore. But living in Missouri, I guess your best bet is putting it on a nice grass surface, especially in the morning when the dew is on the grass, and you get a great conductivity, with the Mother Earth energy.
Well, be specific about that, because you're right. I can walk out my back door in the morning and it can go a month without raining, and my grass is always wet then. So you would suggest just walk around for 10, 15, 20 minutes?
Yeah, even less, Brad. I mean, we've done research on this, and it's almost instantaneously. When you put your feet on, let's say, a wet grass in the morning where the dew is from the night before, the conductivity of the Earth's surface is the best. Or it's like walking on a seashore. I tell a lot of people in Florida, for example, if you can walk on an incoming tide or an outgoing tide, it doesn't make a difference. But in other words, you walk in that little surf around 2 or 3 inches, around your ankle. The ocean is loaded with minerals, and that wet surface improves the conductivity. And living in Missouri, walking on the grass in the morning when it's wet, it's great conductivity. And again, you'll be taking in the Schumann resonance. And what this is, Brad, it's a 7.83 hertz. It actually has been measured. It comes from lightning strikes around the planet, especially around the equator. And, where I live in Florida, around the Tampa area, that's the lightning capital of the world. So have you ever gone outside after a lightning storm and you smell the ozone and stuff like that? Well, if you go out barefoot on that wet grass, you'll be healing your body. Absolutely. And I just feel it's one of the natural things you can do. In fact, the next book I'm writing is called Get Grounded, Get Well. And there's been so much research on this whole grounding movement, and it's free, Brad. It's absolutely free. So, this is a good healing remedy we can all use in our lives.
Well, as I go through the list of books that you've already written, The Great Cholesterol Myth, Reversing Heart Disease Now, Heart Sense for Women, you have gone out and found things that maybe some of us just don't think about, or most of us don't think about.
The beauty about being a physician is that people are your greatest informants. In other words, when you see people on a day-to-day basis and people are miserable or sick, et cetera, and all of a sudden you find that you create the perfect combination where they get well and they come back and they report back to you. Our patients are our greatest teachers. So even when I would fail at a treatment, I would ask a patient to, look up things on the internet, read books, et cetera. And if there's something I don't know that they can teach me, I ask them. And lots of times patients would come in and say, Doc, I tried your remedies and it sort of helped somewhat, but I found this one and this worked better. I said, well, what was it? And then, one person can teach me, and then I can teach so many other people. So that's the way it works in medicine. And when you're doing that for decades, you get a lot of gray hairs, Brad, and you get a lot of experience. And that's why doctors shouldn't retire. I think doctors should be working into their 70s and 80s, because it takes a lifetime to learn about what really works with healing in people. I can tell you that for sure.
Well, you can think of this at 75, you still have your hair. And so
yeah, I have my hair, and I'm not really that gray yet, so I'm blessed,
Yeah, I don't have the gray part down. I've had that since I was in my 30s. One thing that I see here, it talks about, as you're working on medical treatments, complementing, with pure medicine with nutritional, anti-aging, and psychological therapies. So you're telling me if we do it as a combination, we have a much better chance of improving our lives when otherwise we might not.
Oh, absolutely, Brad. I mean, listen, when a person is sick, and I mean suffering, I'm a heart specialist. So, heart disease is I lived with patients for decades with heart disease, and these people suffer. Sometimes they can't breathe, they get chest discomfort, they get angina, they get arrhythmias, they break out in sweats. And what I tell them basically is this, whatever remedies you can bring to the table, basically they can be, nutraceuticals, vitamins and minerals. They can be foods that heal. They can be psychological therapies. I mean, if patients can meditate, they can pray, they can focus on a mantra. I mean, there's so many things that patients can do to attenuate the autonomic nervous system. I mentioned grounding before. So in my job as a physician, whatever works in the healing process. I mean, it can be pharmaceutical meds. It can be, psychological therapies. It can be mind-body medicine. I mean, it can be anything. It can be grounding. It can be, the avoidance of carbohydrates and sugars. I mean, the list goes on. And we haven't even talked about detoxification. I mean, so many people are toxic today from mercury and heavy metals and petrochemicals in the environment and GMOs that are in the food supply. So, people don't realize it, but there's a lot of things that can make them uncomfortable. And going to the right doctor or the right healer sometimes can make all the difference in the world.
Okay, let's take a quick second time out. When we come back, we'll be joined again by Dr. Stephen Sinatra, and then we'll do that in just 2 minutes. And welcome back to Boot Heal Now. My guest is Dr. Stephen Sinatra, cardiologist, author, speaker. It's great to have you here, by the way, today. I've learned a lot. And it's one of these subjects that I suspect we could talk a long time. As we, as patients, say, I'd like to know more about Dr. Sinatra and what he's talking about. What could they do if they would like to learn more?
Well, I mean, they can go to the Healthy Directions website, drsinatra.com. They can learn a lot about vitamins and minerals. There's a lot of information on there. They can go to Vervana.com. That's my healthy food website, because I'm a strong believer in foods that heal. I mean, even in COVID-19, I mean, I think one of the best things you can do in the battle against COVID-19 is eat a lot of onions and garlic, just like, during World War II. I mean, garlic was like Russian penicillin. I mean, there's a lot of healing capabilities in natural foods. And I mean, certainly vitamin D has been really extremely good in the battle against COVID as well. And I love coenzyme Q10. I mean, coenzyme Q10 I've been dealing with for decades, Brad. And I got to tell you, even against infections, I mean, what the miracle of coenzyme Q10, it helps to prevent what we call inflammatory mediators. Doctors call it NF-kappa B, interleukin 6. A lot of people heard about C-reactive protein. And one thing that CoQ10 does, it mediates those inflammatory mediators. In other words, it puts a blanket on them. It combats them. And, CoQ10 supports endothelial cell function. So even in the COVID-19 era, I love vitamin D. I love coenzyme Q10. I love quercetin. I mean, the list goes on and on. I even like this supplement called Andrographis. It came out of Thailand and India, but, it's a potent anti-inflammatory. And, even in the Far East, they're using this against COVID-19. And people can even get this in a health food store. So there's so many things people can do, non-pharmaceutical treatments that can really give them an edge going forward. And that's what doctors like myself do, in this contemporary environment that we live in.
Well, I always let my guest have the last word. Is there anything specifically that you think that we need to know as we leave today?
Well, if you do have allergy symptoms, and if you develop fever and shortness of breath, that takes it away from allergy. A lot of people can't distinguish between an upper respiratory infection like a flu-like illness or, God forbid, COVID-19 or allergies, especially if it gets into the lung. So I think the important thing here, Brad, once you develop fever, That means this allergy could go to a higher level. It could be an infectious agent and perhaps even something as bad as COVID. So if you do develop fever, a loss of taste or smell, or any of those ominous symptoms of COVID, you need to speak to your physician. So I would end on that note. But again, if you don't have fever, you're in good shape, and it's most likely allergy. But sometimes it's hard to distinguish between allergy and infection. I know it's been even hard for myself as a physician. So I know it must be hard for lay public as well.
But I would finish off by saying, make sure you involve your physician with especially severe types of things. Dr. Sinatra, thanks for your time today. Appreciate it.
Hey, Brad, it was a lot of fun. Good luck, and God bless.
Okay. Good to see you. Again, Brad Thurlow here, Boot Heel Now, and we will see everybody again next week.